Hello, everybody, and welcome back to the Beat Podcast by Health. I'm excited to be hosting Ben Forrest on the podcast today. He is the CEO of Olio, and they're dedicated to transforming how payers, health systems, and post-acute providers collaborate. We know it's a challenge, and it's needed more than ever. Such a pleasure to have you with us, Ben. Thanks for joining.
Yeah, thanks for having me, Saul. I appreciate it.
Of course. You guys were busy during health. There was a couple conferences going on, and you guys had a lot going on over there, huh?
Yeah, it is what it is. It's good to be busy. And it's kind of exciting, frankly. The long-term care spectrum or part of healthcare, just because of the pandemic and the compressions economically that happened post-pandemic, it's really exciting to see that kind of world start to flourish. And they're running a parallel conference down the street from health in Las Vegas. So it's good to see that engine cooking too, and health is always doing its thing, which is fantastic as well.
Oh, yeah. Help us understand what Olio does. Give us the level set on them.
Absolutely. We are a care coordination technology, specifically software designed for most of our businesses with payers, a fair amount of provider health system business, but really centered around complex patients. Think elderly, later stages of life that are going through different levels of care where they need a little bit more attention. And so our software brings all those stakeholders together. We are very intentionally designed to make sure that patient stakeholders, caregivers, as the patient goes from a hospital to a skilled nursing facility, a home health environment, a lot recently of behavioral health and substance use, severe mental illness treatments, just the most complex patients that need their care coordinated amongst various stakeholders.
Yeah, fascinating. And so given the age range, are you focused on the Medicare Advantage population or?
All the above, really our customer.
Yeah,
our customer kind of tells us what's important to them. And we hope that everybody's important, frankly. But which type of providers do they want to be intentionally engaged on a daily basis to work through complex patients? Those could be Medicaid patients, Medicare Advantage patients, ACO patients. We're seeing a lot of conversations in around mandatory bundle payments as the team bundle becomes in the fold. So the economics are varying, but the core is still that, hey, coordinated care is better if providers are engaged with each other.
Amen to that. Yeah. Okay, cool. Thanks for clarifying. And so what's the story of Olio? How did it all start?
I joke around sometimes, there's folks that are dying to be entrepreneurs. I wasn't that guy. I got obsessed with a problem. I was working in the medical device industry. I spent 14 years there. And oh, great. And you were in that space, you have a bit of a front row seat to, in my world, it was folks in orthopedic and neurosurgery, a lot of access to healthcare leadership within health systems. And late years of Obama, when mandatory bundle payments first or episodic payments came into the conversation, it was very apparent that a lot of healthcare is trained to provide care where the patient is, where they are. But we don't work together real well as patients move through various levels of care. And so I became obsessed with that problem and very much just wanted to bring modern technology ideas and theory, maybe non-healthcare software ideas to solve for that complicated problem.
That's cool, Ben. What were you selling in the med device space? Were you in spine?
Pretty much exclusively spinal implants, pedicle screws, interbody cages.
Same.
Really? Yeah.
Yeah.
We can vibe on that at some point for sure.
We'll have to talk offline about the scars.
That's right.
Oh, that business.
For sure.
Super cool, man. Super cool. All right. So you talked about administrative burden. It's one of healthcare's biggest pain points. What specific bottlenecks is Olio eliminating for providers and payers? And how do these improvements translate to better patient outcomes?
Yeah, great question. Think at the core of it, whether it's operational burden, administrative burden, what is kind of unbelievable is how poorly payers and health systems engage with their providers in their community. As a complex patient, they may authorize care. They may kind of look at data based on care in the rears, but they're not very good at engaging with that team that's on the floor of a skilled nursing facility or inside a behavioral health treatment facility, right? And that is shockingly one of the biggest administrative burdens is how do I get the right stakeholders coordinated together so that they can execute on a day in, day out basis? Like Uber is really good at connecting people that need a workflow to get and give a ride. And we see the world very much the same way. Software and the user experience and all the things that come together that enable a patient's stakeholders to be engaged on a daily basis and intentional about it, we've seen it in our 7-year history have a dramatic impact on the outcome.
That's great, man. And so it's really an underappreciated or under-engaged physician. That's the key problem, or
No,
caregiver.
I would say it's more like this. Like if you've got, let's say you brought up Medicare Advantage in the beginning, you got 50,000 lives and they're entering levels of care where potentially the cost is going to be the most high, right? They had a hospital event and now they're stepping down in care through various levels. Well, how do you get Mary Smith that works at Whispering Meadows to engage with you, the big insurance company? If you're building care management teams to support these member populations, you want the providers to have a good experience. What does engaging with them, what's the workflow look like, and how much do you care about that provider, a home health clinician and their experience working with you as you possibly an insurance company or health system in a capitated arrangement hold risk around the economics of the patient's outcome?
Got it. Okay, fair enough. Got it. Thanks for explaining that. And ultimately, it's those care providers making sure you're helping the payers help engage them better so that they feel like they're in the loop more.
Yeah, in the loop, but just really have a process to do that. That scales. Most of our customers have 100 plus sites of care inside a geography that their membership sits. 100 plus sites might be 2,000 users of Olio working with the payers users, and they all have a very intentional workflow to manage a case for, say, the 15 days while the patient's at Whispering Meadows. And so that orchestra gets pretty big, and software helps connect all those dots to make sure everybody's in the loop.
That's cool, man. I appreciate that. Thank you for explaining that. A big topic of discussion on this series has been reimagining care delivery for just both access and outcomes, especially for historically underserved populations. Talk to us about how Olio is making a difference in that space.
Yeah, I mean, I don't want to sound like a broken record, but as we've tracked our longer customers' efforts to serve different populations, maybe could be episodic, could be by a line of business, Medicare Advantage or Managed Medicaid or what have you, how well our customer, meaning a health system, a payer, engages with the entirety of that provider landscape has a direct correlation to the outcomes and cost of care. And so we are just trying to be the best product on the market that enables large scaled healthcare infrastructure to stay engaged with providers downstream. And it's a challenge. And I think there's a lot of opportunity there that we hope to make it just a small scratch at the problem. And we welcome others to take a stab at it as well.
I guess in general, Ben, would you say that this area is just maybe a black box and lacks process overall, and you guys are layering in to help that?
I think that's exactly right. The scale of the problem, right? So a lot of organizations are really good at figuring out something, a physician to a facility or one hospital location in a greater health system might have process and organization really figured out. But how do you scale those things, right? Like EMRs have done a really good thing inside organizations to make sure there's a process of documentation and charting, et cetera. But what is a whole state's process for coordinating care as patients kind of enter these community sites? So that's just it. And then on the backside of that, giving that those organizations that are coordinating care with large health systems, large insurance companies, the opportunity to understand how they're performing and how it's going relative to their efforts. So I think transparency, engagement is huge to the overall opportunity to improve outcomes. And we are pretty much, it's a bit of an obsession on trying to stay focused on delivering software products that make that happen on a daily basis.
That's cool, man. And I'm just sort of connecting the dots here, Ben, and FQHCs play a big part of that infrastructure at the state and local level. Is that part of the infrastructure that you're building here and kind of helping them connect the dots?
It can be. Our customers tend to kind of live under their own roofs to some extent and really just kind of exactly what populations. The reality is, I mean, whether it's controversial or not, and folks that know healthcare know this, like the economics play a piece in this. And where you have capitation or a desire to manage the control of medical spend tends to be where our customer points us and says, all right, let's make sure that we are coordinating care, engaging with providers and ensuring that the patient gets the best outcome. And we're not going to let our intent to be engaged or be present be a barrier to success.
Got it, man. Look, you can't go to any conference, listen to any podcast without hearing AI.
Yeah.
So we just got to bring it up because, I mean, we just have to, right? So talk to me about what role AI plays in the future of care coordination.
Well, to be totally blunt with you, I don't think anybody says they know, they don't know. I have spent about a year, I actually block calendar every day to research and do more, even as the CEO of our company, to get really kind of, you can't build and develop software fast enough. I like to joke with our software engineers, like, used to be you get to the end of the product roadmap and celebrate for a week. Well, by the time we get to the end of the product roadmap, we're already behind at this point. And that's really not just because it is. It's just, it's a fun and complex time. There's just a lot of effort that needs to go into understanding what's the right path. As you ask relative to AI and care coordination, I mean, I think the smart companies are going to be really good at something before they try to be good at everything, if you will. And so we're very intentional about being good at solving for things that are maybe operational that help these providers that we love that they're working together. How do we make that even a better experience by putting language model technologies and doing some things with AI? That's what I look for when I look at AI, not only just to use in my own personal life, but as we think about what we're going to spend capital on and deploy and hopefully improve outcomes, is let's be really good at one thing first and then broaden that to 2, 3, 4 things. And everybody has their own sector of AI that they're deploying, whether it's predictive or operational or fill in the blank. So that's where I'm at. And I kind of fully answer your question. I don't know what the cat's meow is just yet, but I think you got to block the energy and time and investment in continuing to put one foot in front of the other.
Love that, brother. Well said. As you look ahead to the next 3 to 5 years, what bold bet is Olio and team making that you believe is truly going to transform the healthcare experience?
Yeah, I think the bold bet, I mean, if I'm like, hedging my bets, we're true. I do like a little wager every now and again. If I'm placing a wager, you were at health. There's a lot of people that were either not there because of the changes in some of the insurance companies. There's just a lot of turmoil, right? We know that. That is what it is. But I do think that the large insurance companies that are going to continue to succeed, whether it's star ratings or earnings calls or you fill in the blank, are really going to have to get good at managing medical spend. And that's potentially good for U.S. folks in all facets of healthcare. And so I don't really know what that means yet, but I think my bet is that these earnings calls and some of the share price results and some of the successes of large insurance companies you're going to have to actually not spend so much on healthcare. And my hope is that is not just to get better at authorization techniques. So that's my bet. I'm sticking to it.
I love it. Well, thanks for that, for sure, Ben. Look, if people want to learn more, are you guys national? Kind of give you the last chance here to talk about the footprint, who specifically you serve and who you want to get in touch with you, and the best way they could do that.
Yeah, well, absolutely. Our website's olio.health, www.olio.health. Come there. We are pushing out new stuff on, I think, the most we ever have, quarterly at a minimum. We just launched a bunch of new features this week, and it's just constantly changing. Like I mentioned, we talked about AI, and it's not just AI related, but if folks listening and you are interested in how your organization can engage with scaled post-acute and behavioral health providers and what that might be able to do to your outcomes and potentially your operational efficiencies from on your side of the house, reach out to us. I think you'd be surprised at how easy things can be and how easily care can be coordinated. And ultimately, you can be a rock star for your org for engaging with us.
Amazing, Ben. Really appreciate you sharing that. And folks, we'll make sure to add all the ways to get in touch with Ben Forrest in the show notes. So make sure you check those out. And Ben, thanks for spending a little time with us today. This was fun.
Thank you, Saul. Appreciate it. I'll take you up on, we'll talk pedicle screws at some point.
Anytime, brother.
All right.
Anytime.
Thank you.